Thank you for joining Cancer Support Community Atlanta for this program. Please visit our website, cscatlanta.org, for a complete list of live and recorded events. We invite you to sign up for our newsletter to stay connected to all future programs.
All right. Welcome, Savannah. Thank you for presenting today on eating with a decreased appetite. Savannah is the high risk and survivorship dietitian with Northside Hospital Cancer Institute. This will be a fantastic nutrition seminar today. We're so appreciative for you joining us, and y'all feel free to ask questions at the end. But thank you, and I'm turning it over to you, Savannah.
All right. Thank you, Lauren. I'm happy to be here with you all today. I'm actually coming to y'all live from the Cancer Support Community Kitchen. So if you haven't been down here before, you get a little sneak peek of it behind me. But we did this presentation last fall and it got a lot of great feedback. So we wanted to bring it back around this spring, as eating with a decreased appetite is, something that so many cancer patients struggle with. So I hope that we'll find this, relevant to you today. So, what we are going to cover today is some of the possible reasons for why we might be experiencing a decreased appetite, while also understanding why it's so important for us to obtain adequate nutrition during treatment or just our health journey in general. We'll cover some strategies that will help to combat some of these struggles. And of course, I always like to throw in some meal and snack ideas so that you can have some practical, ideas to take home with you after today. And then we'll also talk about knowing when to ask for help, when maybe some of this is, you've done your part and maybe we need to look and see what other support we can get in order to make sure that we're staying nourished through our treatment journey. Okay. So as I mentioned, our decreased appetite can be caused by many different factors. And it can take place at all three stages of the cancer journey. So either pre-diagnosis or newly diagnosed before you've started treatment, to the actual treatment phase where you're actively going through, maybe the surgery, the chemotherapy, radiation. And then even in the survivorship stage, there might be some reason why you're still experiencing some decreased appetite. Of course, the first reason is potentially the cancer itself, depending on the type of cancer and where it's located. Sometimes cancer patients experience a decreased appetite before they've gotten a diagnosis. Lung cancer is one example of that. So sometimes it is the cancer itself causing this decreased appetite. Stress from the diagnosis or from external factors of other things you might be dealing with at this time can also cause decreased appetite. Same with pain. If we're in a lot of pain, of course, that's going to be the primary function that our mind is going to be focusing on within our body. It kind of suppresses our appetite while we kind of are focusing on that pain we might be experiencing. Nauseousness, either related to the cancer or to medication or to the stress and anxiety, might also cause decreased appetite. And so might dehydration. Now, this differs from patient to patient. Sometimes dehydration increases appetite because your body's looking to obtain fluid from foods. But more often than not, when we're fairly dehydrated or chronically dehydrated, our appetite tends to decrease. Of course, specific medication, chemotherapy, or treatment side effects can cause decreased appetite. Same with changes in our bowel habits, whether we are experiencing constipation that makes us feel so full that we don't want to eat anymore, or perhaps on the other end, if we're experiencing diarrhea, we feel like any food that we do eat might worsen those symptoms. It's not likely going to help that appetite. And then, of course, changes in our mouth, whether it's taste and smell changes or mouth sores or even difficulty swallowing can affect our appetite. And then last but certainly not least, I think most of us have experienced fatigue at some point or another, but that can certainly affect our appetite as well. So this is just to kind of give a picture of some of the things that you maybe have experienced or could potentially experience that might be impacting your appetite. And it's helpful to identify what could potentially be causing it so that maybe we can address the initial, cause of decreased appetite in addition to implementing some of these strategies that we're going to talk about today. So, why is it so important for us to maintain adequate food intake? Well, our goal before and during treatment is to maintain our lean body mass as well as our body's store of nutrients. That way, we can keep up our energy, reduce fatigue, and overall just feel better during treatment. Staying well nourished can also actually help us to better tolerate treatment related side effects. For example, if we are able to get ahead of nauseousness and keep something, in our belly at all times, something soft, easy to digest, like some crackers or some oatmeal, that can actually help prevent the nauseousness from getting worse. So sometimes, making sure we're eating enough actually helps reduce some of the side effects. Of course, that helps to keep our immune system strong and lowers our risk of infection. And it also helps to prevent or delay treatment. So, oftentimes, certain treatments are based off of our weight. So, they're partially dosed based on our body weight. And if we don't end up eating enough and we lose significant amounts of our body weight, our oncologist might need to pause or delay our treatment in order to redose the plan to restart it at a more appropriate level for your new weight. And of course, typically delays and breaks in treatment aren't what we want to happen. We want to get through those treatments as quickly as possible. So, when we talk about losing lean body mass, one thing that can occur is called cachexia. So, cancer cachexia is a syndrome that can affect up to 80% of those with advanced cancers. And it's marked by a decline in skeletal muscle mass, which could happen with or without fat loss. So, in other words, how do we know if we have cachexia? Well, some symptoms or signs that you might be experiencing this is if you're suddenly having a harder time carrying out some of the activities of daily living, excuse me, that prior to treatment or prior to diagnosis, you were carrying out perfectly fine. So, some examples are climbing the stairs easily, or getting in and out of chairs without needing to use the armrest, or having a hard time lifting things or moving things in your home that you were previously able to move with ease. Those are some of the signs that you might be experiencing cachexia and indicate that we want to do everything we can to preserve your skeletal muscle. So, what are some signs of decreased appetite? Now, if you yourself are the patient, it's probably easy for you to kind of know when your appetite is fluctuating, when it's increased, when it's decreased. So these tips are really geared for caregivers who might be on the call. So if the person you're caring for has little or no interest in food or refusing to eat their favorite foods, that can certainly be a sign. Of course, those weight changes can be a sign as well. Now, this isn't perfect. We might have weight fluctuations from other causes, perhaps changes in fluid status. But if you are seeing a decline in weight steadily or over time, that might be a sign that we're not eating enough and that decreased appetite might be playing a role. Another sign is that the person that you're caring for is having changes in their meal schedule. So if they used to eat 3 meals and 2 snacks a day, and now they're down to maybe just 2 meals or only a couple snacks a day, that's also likely a sign of decreased appetite. So once we've identified it, what can we do? The very first strategy that I like to use with all kinds of causes of decreased appetite, whether it is that nauseousness or it is diarrhea, is to use the clock to your advantage. Most of us, prior to a cancer diagnosis, eat 3 meals a day. But that can be harder for someone with a decreased appetite. Maybe you get tired while eating a large meal. So instead, I always recommend trying to eat 5 to 6 smaller smaller meals or snacks throughout the day. So this typically is going to be every 2 to 3 hours. Now, we call this eating by the clock because when you've experienced decreased appetite or weight loss, Our body isn't providing those hunger and fullness cues the way they used to. They're not quite as reliable for us. So instead of trying to listen to when we're hungry, we want to go by the clock. So setting an alarm or having some other indicator that every few hours, even if you don't necessarily feel the hunger pain yet, you do want to go ahead and eat in order to keep up with your nutrition. So, like I said, if you need to set an alarm, or maybe this is a great way for a family member or friend or someone in your household to kind of act as an accountability partner and check in on you to make sure you're eating throughout the day. Eating a bedtime snack is also another great strategy. This is because oftentimes the complaint I hear is, well, if I eat too many snacks or if I eat at 10 a.m., I'm not going to be hungry yet by 2 p.m. But a bedtime snack, you have all night to digest your food. So it's a great way to give you extra calories without affecting your appetite at breakfast. So with this, I recommend giving yourself at least 30 minutes between eating and going straight to bed, just because digesting is an active process and you don't want it to disrupt your sleep by digesting a heavy snack or something with high fat, perhaps. So at minimum, give yourself 30 minutes between eating the snack and going to bed. An hour, hour and a half is probably more of an ideal time frame, especially if you're getting in a little bit of a heartier bedtime snack. Now, if you are experiencing hunger, if that sensation is still happening, it's just maybe not as voracious as it used to be, that is when you want to plan to have larger meals or larger snacks. For a lot of folks, this is earlier in the day, so your breakfast time, because you had that fasting period overnight. So that's when you can really focus on making sure you're getting high quality foods at that meal to help keep up with your nutrition status and all the nutrients that you need throughout the day. Okay. So food preparation is going to be the next strategy we talk about. If we're trying to eat 5 to 6 times a day, that can feel really burdensome if we're expecting to have to prepare a meal every time we're trying to eat. What I recommend is trying to keep your pantry and freezer well stocked with foods that are ready to go that you can grab quickly or toss together in a pinch to assemble a hearty meal or snack. This could be things like single serve entrees or ready to eat packaged food. So some examples are going to be things like individual serve hummus cuts or hard boiled eggs that have been peeled already, or pre chopped fruits and vegetables, or guacamole cups. Or in the pantry, this could be things like trail mixes, or protein bars, or dried fruits. So things that are going to be easy for you to just grab and go. This is a great time to ask family and friends for support in preparing meals for you. So if you have a support system, if people have offered let me know if I can make you a meal. This is great because any meal or snack that can be provided for you is one less meal or snack that you have to worry about preparing yourself. If that's not an option, or if you know or are anticipating decreased appetite, we can also go ahead and try to plan for that and make some meals and snacks ahead and freeze them for when you might need them. So, for example, if you have a surgery coming up and you know that you're not going to be as mobile, maybe you'll be on some pain medications initially after surgery, you might want to go ahead and pre stock that fridge and freezer so that you don't have to worry about what foods you're going to eat while you're in those initial recovery stages. The same goes for if you're going to start radiation therapy or if you've identified certain times during your chemotherapy regimen where you experience more fatigue or more difficulty eating. You can go ahead and prepare your fridge and freezer for those days. Okay. So, of course, not only how often are we eating, but what we're eating is going to matter. So, we are going to want to focus on higher calorie and higher protein foods if you have experienced that unintentional weight loss or are really struggling to eat and you know you're only getting in a little bit of food each day. So, whenever we're having our meal or our snack, we want to start with a protein source. So, protein helps us to hold on to that muscle mass. It helps support hormones, which our hunger and our fullness cues are partially based on hormones. And it also helps to support our immune system, among many other, of course, very useful uses for protein. So, our protein foods are going to be our meats and poultries, beans and other legumes, so our lentils, eggs, fish, nuts, seeds, and our protein containing dairy. Now, that protein containing dairy is important because remember that some dairy foods don't actually have very much protein in them. That's going to be things like our almond milk, coconut milk, and oat milk. Even though those are a dairy replacement, they don't actually have very much protein in them. So you might want to switch to a product that is going to have more protein, like a soy milk or a dairy milk. We want to also make every bite count by choosing higher calorie foods. Now, sometimes this is going to include higher fat products. In a perfect world, we would be choosing some of the healthier high fat products, things like avocados, olive oils, our nuts, seeds, olives. Those are all going to be great sources of heart healthy fat. You can also sneak in extra calories by adding in things like condiments, dips, breads, and oils to your foods in order to really maximize nutrition without filling you up too quickly. So, you know, typically we think, oh, okay, well, for heart health, maybe we don't want to do a ton of butter. Well, when you're going through a temporary phase, like your cancer treatment, and you're really struggling to eat foods or get any nutrition in, I would rather you focus on getting those nutrients in, and then we'll kind of worry about, maybe those longer term implications down the line. Okay. We also want to choose whole fat dairy products instead of skim if you can tolerate it best in order to help get extra calories in. And another tidbit is instead of choosing fresh fruits that have a high water content and can really fill you up quickly, you might want to try switching to dried fruits temporarily so that you're still getting a lot of the nutrients without feeling quite as full. That way, you're leaving room to add in other foods at that meal or snack, like the protein, for example. So, as promised, let's talk through some warm or room temperature snack ideas, and then we'll look at some cold snack ideas on the next slide. And this is because you might have some preferences on the temperature based on your treatment or just personal preference. So, avocado toast is a great example, a great option because you can get fiber and calories and energy from the bread, and you can get more fiber as well as some healthy fat and calories from the avocado. A bonus would be to add something like scrambled eggs to it for a little extra protein. You could do something like a hot chocolate made with whole milk or trail mix we mentioned. You could do a combination of nuts, seeds, and dried fruit. Could do peanut butter and jelly or peanut butter and fruit on a sandwich, an English muffin, a regular muffin, or oatmeal for extra calories. And then you could heat up something like a cheese and bean quesadilla for some protein and some healthy carbohydrates. Or if you need a smaller snack or a great bedtime snack, would be something like peanut butter and crackers. So hopefully these give you a good starting point of kind of the direction we're looking to move in with our snack options when we're experiencing the decreased appetite. So you'll notice that we're still focusing on nutrient dense snacks. We're not necessarily wanting to fill up on potato chips or, you know, pastry, things like that, things that have a lot of added sugar. But of course, if that's what you're craving and that's what you need to kind of get you through the day, if you need a snack like that, that's okay. Of course, our preference would always be something with more nutrition and nutrients like these options here. Okay, so our cold snack idea. We could do something like a Greek yogurt, which is a high protein yogurt option, and add fruit or dried fruit with nuts and seeds to it. You could make ahead of time some chicken, tuna, or egg salad and pair it with crackers or pair it with some veggie sticks. That's something you could keep in the fridge for up to 72 hours before you maybe want to toss that for food safety reasons. You could do cheese and crackers, or cottage cheese with fruit. You could do something like a chilled pasta salad and make sure that it has a protein in there. Again, a tuna or a chicken is a great, easy option. Hummus with crackers, pita, or vegetables. Frozen yogurt or ice cream is a good snack option. Or you could do, again, like grapes, cheese, and olives for some heart healthy fats and a little bit of protein. Okay. So we've talked through some of the solids, but we can also use liquids to our advantage when our appetite is decreased. So what we can do is number one, make sure we're sipping on liquids throughout the day, even if you don't feel like eating. We can choose liquids that are going to add calories and other nutrients. Or we also can just, we can also sip on water to help make sure that we're staying hydrated so that that is not affecting our appetite either. So we want to only drink a small amount of liquids when we're actually eating those meals and snacks, though. That's because many folks are going to feel too full if they eat and drink at the same time. So that's why we maybe recommend drinking throughout the day, sipping constantly as opposed to pairing your meals and your liquids together. You can also choose higher calorie, high protein beverages. So that's not just limited to our food options. And we'll look at some examples of those on the next slide. And lastly, we can choose our oral nutrition supplements. These are a very helpful tool. You might hear them referred to as just protein shakes, but our oral nutrition supplements are also going to contain many of the micronutrients that you need that you might be struggling to get through the diet at this time. So let's look at some examples. For drink ideas, we could do something like a milk that's going to give us some protein if we're choosing a soy milk or a whole milk. A dairy milk. It could be, whatever level of fat. Um, or if you just simply want the calories and a little calcium and vitamin D, you could also choose one of those plant-based milks that we mentioned earlier. Fruit juices are a great way to get some extra calories in and some good hydration. Preferably, we still want to choose 100% fruit juice instead of the fruit juice that's maybe added with other sugars. Carnation instant breakfast is a great option. This will also add some of those micronutrients that we're looking for as well. And you could always make some homemade smoothies or milkshakes if it is a lot easier for you to get your calories in through those liquids versus those solids. Okay, and then for protein shakes or oral nutrition supplements, you really have a wide range of options. Two of the most common are called Ensure or Boost. You can get these at most stores and online. Perhaps these are the brands that your oncologists might be referencing. If you have issues with blood sugar control, maybe you're having some hyperglycemia from some of your steroid medications, or you have the diagnosis of diabetes, Glucerna is a glucose controlled option. So you could choose that. Or I believe Boost also has a glucose control option in their inventory as well. Now you could choose Premier Protein or Fairlife. These are ones you can get at Costco. You can get them at Kroger. They might not necessarily have additional vitamins and minerals, but they're a great protein shake option. Orgain is another option that they have multiple plant-based choices if that's your preference to choose a plant-based protein shake. And then many stores are also going to have an equivalent or store brand version. So I believe Equate is Publix's Ensure equivalent, but some of the other stores or maybe online retail places might have an option as well. If you feel really lost as to what shake to get, when in doubt, your taste preferences can help guide the decision. Or this would be a great question for your dietitian, for your oncology dietitian. You'll see in the photo here that all of these, let's see, six bottles is the brand Ensure, and they have many different options. So they're going to range from ingredients to the consistency to the amount of calories versus protein. So if you feel overwhelmed with choosing which one's right for you, don't be shy and go ahead and ask for help. And hopefully, someone on your care team can help point you in the right direction. Right. So, what if we are experiencing taste changes? So, oftentimes, this is a result of certain medications or chemotherapies. So, this is going to differ for everyone because everyone is going to have different taste alterations and preferences. Oftentimes, foods with tart flavors are better tolerated. So, these are things, like lemon, lemonade, other citrus fruits, and even pickled foods are often actually desired when we're experiencing taste changes. Now, to add a level of caution here, if you're also experiencing mouth sores, you're going to want to limit these acidic foods because that's probably going to, inflame the mouth sores that you're experiencing. Try marinating your food. So if you're making a meat, a chicken, marinate them overnight so that the flavors are seeping into the product so that hopefully you're kind of masking any tastes that might not be appealing to you. Sucking on sugar-free lemon drops, gum, or mints can help keep your mouth clear. Or if you like that flavor, that can just kind of help to keep, a more pleasant flavor in your mouth. If water is not appealing to you, which does happen quite a bit, I have experiences with patients. What we can do is flavor our water with a water flavoring agent like a crystal light, or put fruit in our water, or even a dash of fruit juice to help dilute our beverages might help as well. Seasoning your food, so of course the herbs, the spices, the condiments, um, to your liking. This you can switch up and alter based on your preferences. So really, the sky is the limit here. If you're struggling to eat a lot of sweet foods, including fruits, you can try eating frozen versions. When it is frozen, sometimes that taste is a little bit more subdued, so you can eat that more easily. And that can also help to increase your hydration. Okay. And then if you're experiencing a metallic taste in your mouth, really the best thing that you can do is try using plastic utensils, plates, and cups versus the metallic utensils, because that is going to exacerbate that taste in your mouth. Lastly, we do recommend this solution that comprised of ingredients that you probably already have in your home. So this is a homemade mouth rinse. It is a quart of water, a teaspoon of salt, and a teaspoon of baking soda. You mix all of that together and you swish and spit just as you would any other mouth rinse. This is going to act as a really gentle cleanser. It's going to clean out your mouth before and after meals so that we're getting rid of any lingering food that might be affecting the taste in our mouth. It can also actually help prevent mouth sores and help just take care of your mouth cavity in general. So this is a really great tip. It doesn't always work for everyone, but I do usually see an improvement with using the oral care rinse, even if it's not a 100% improvement. Okay. So a few other tips and strategies I want to leave you all with. Move around when you can. Gentle exercise and movement helps with so much during the cancer treatment process. It can help reduce fatigue, improve overall well-being, and also help stimulate the appetite. Can also stimulate bowel movement. So if you are experiencing constipation, this is a helpful tip for you as well. As often as you can, try to make your mealtime something to look forward to. Eating with loved ones or setting the table nicely, playing music, watching a show that you're looking forward to, that can all help to make the experience a little bit more, enjoyable. Use the clock to your advantage. So we talked a little bit about that earlier, but you can get creative with this. Use commercial breaks on TV as a cue to eat or drink. Or if you're feeding your pet or taking your pet outside a couple times a day, that can be a reminder to also take care of yourself. Or, any other kind of daily habits that you already have, you can kind of stack on your eating or drinking to that so that you're kind of killing two birds with one stone. And lastly, if you feel like you've tried everything and you're still really struggling, you can discuss with your physician if an appetite stimulant is going to be something that is right for you. So there's a few different medications on the market that are known to help increase appetite. And depending on your situation, this might be something that is beneficial. Okay. So a couple other indicators that you might want to reach out to your care team and ask for help is if you're experiencing any of these symptoms for a prolonged period of time. If you are feeling nauseous and are unable to eat for more than a day, and you were anticipating that, certainly let your care team know. If you've had that unintentional weight loss, this is something that when you come into your clinics, when you're meeting with your physicians, they'll be checking your weight. But if you have a period between visits and you notice that you're rapidly losing weight, especially 3 or more pounds in a week, you'll want to go ahead and alert someone on your team. If you're having pain with eating, whether it's swallowing pain or severe pain in your stomach, go ahead and alert someone. And if you're not able to urinate for more than 1 day, or you haven't been able to have a bowel movement for more than 2 days, you certainly want to let someone know as well. Of course, if you're having episodes of emesis or vomiting for more than 24 hours and you're unable to keep any fluids or foods down, that's another sign that you'll want to let someone know. So these are all, reasons to reach out to your physicians, your nurse practitioners, nurses on your care team. But if you also just want a little bit more of that one-on-one guidance to figure out how you can just maximize your nutrition, keep your appetite up, stay on top of your weight and your nutrient stores, you can also see if you have a dietitian available. So I'm with Northside, and we do have multiple, we have dietitians at most of our clinics or affiliated with most of our clinics. So ask your oncologist, nurses, or nurse practitioner to give you a referral, or you can email us directly at outpatient.nutrition@northside.com, and we can help get you set up with your corresponding dietitian. Now, if you're not a Northside patient and you're receiving care at one of the other facilities in the area, they also have dietitians available. And we could always try to help look for their contact information if you're having trouble finding that. So you can still reach out to us, and we're happy to help point you in the right direction.
Thank you for joining Cancer Support Community Atlanta for this program. If you're interested in other live or recorded programs, please visit the online program tab of our website, cscatlanta.org, or follow us on Facebook. We'll be sharing additional information on upcoming programs.